chaired by Larry Summers, former president of Harvard, Bill Clinton's Treasury Secretary, and director of the National Economic Council under President Obama. And Larry has recorded a 10 to 15 minute video, especially for this morning, that I think you'll find quite juicy and provocative. So I'm going to keep my comments quite brief. I'm just going to set the scene for what I hope will be some fruitful discussions over the next couple of days. As Carol and Jerry mentioned, 20 years ago, the bank published WDR 93, Investing in Health. I think it's fair to say that it was probably one of the most influential, explosive global health publications of all time. It helped to push health up the development agenda. It put the bank on the map as a global health player. It was focused on finance ministers, making the case that investing in health isn't a drain, it's an investment in prosperity and well-being. It introduced this metric that we all love and know, the DALY, Disability Adjusted Life Year, very controversial. But importantly, it used that metric, I think, in quite an insightful and clever way. It combined disease burden assessment, as measured with DALYs, with cost-effectiveness analysis to lay out a suite of essential public health and clinical packages. So these are essentially recommendations to policymakers to focus on the highest burden conditions for which there are cost-effective responses. And that led, I think, to quite a lot of rethinking and prioritization around diseases, for example, tuberculosis. There's also a guy called Bill Gates who read WDR 93 twice, he says, cover to cover, and it's what stimulated him to give his money to global health. So prompted by the 20-year anniversary of WDR 93, Richard Horton, editor of the Lancet, invited Larry to chair and Dean Jamieson to co-chair a new commission that's going to look again at the case for investing in health. There are 23 commissioners, half from low and middle income countries. We are meeting 3 times over 8 months, and then my task is to distill the meetings down into a report, 30,000 word report. It will be published in the Lancet on December the 3rd, although we have to submit by the end of June. So what's the report about? There are 4 things that we hope to achieve. We're going to quickly look back at WDR 93. What impact did it have? What lessons are still relevant today? What did it get right and what did it get wrong? Secondly, we're going to look at how the world has changed over the last 20 years, because the context for investing in health today is very different from 20 years ago, in all sorts of ways. I mean, some of these have been alluded to this morning already. Many low-income countries in 1993 are now middle-income countries. There's been a rise in development assistance. There's been the influence of globalization, and so on. The context is tremendously different. Thirdly, something we're very excited about, but perhaps we're crazy, we'll see. We are going to lay out what we think is a bold but achievable and feasible vision for a grand equalization of global health outcomes, a grand convergence between low and middle income and high income countries. We believe, not true in 93, but true in 2013, that within a generation, by say 2035, we could reduce avertible infectious, reproductive, maternal, newborn and child health conditions in the high burden countries to levels that are currently seen, say, here in Europe. We think we have the technical know-how, the financial resources to make it happen if we make the right investments, including crucially, investments in R&D. And fourthly, we can't really talk about investing in health without saying something about the explosion in non-communicable diseases, so we'll also include an investment plan for that. So why then are we partnering with COHRED, this tremendous opportunity? That's because, Jerry will be pleased to know, that Larry and Dean are absolutely committed to having R&D at the absolute heart, front and centre of this report. We agree it did not have enough coverage 20 years ago. Many of the technical experts who are working on this grand convergence framework met last week in Oslo, and it's pretty clear you're not going to reach this end game, if you like. Some people don't like that term, but this convergence or equalization, you can't get there without new investments in research. So over the next couple of days, we would love to get your expert views, your expert input. Partly looking backwards, we want to make the case that the advances of the last 20 years were in part due to R&D. So we'd love your thoughts about that. And then going forward, what do you think are the most crucial investments for this grand convergence and for helping to protect populations against the explosion in non-communicable diseases? So I'm looking forward to hearing from you in the next couple of days. Thank you so much for your contribution to the Commission report. And with that, I give you, I hope, a short video by Larry Summers.